don't you go ahead and slip off your shoes and socks. And when you're ready, I'm going to have you come over here and stand on this black box with your right foot over that clear window in the middle.
Okay.
All right, just stand there with your arms down by your side, looking straight forward.
Okay.
We've got a laser that's measuring the height of the 3 arches of your right foot, and then we take a picture of your foot, and the computer puts those 2 bits of information together to get a 3-dimensional image of your foot.
Oh.
Go ahead and step to your right and put your left foot over the window. We're going to compare your left foot and your right foot to make sure they're doing the same thing, because if they don't, your right knee and your left knee don't work the same. And your right hip and left hip don't work the same, and that can cause stress in the pelvis that translates all the way up your spine. Those 2 ladies in front of you are both 83 years old, and one of them did a much better job of managing the stresses in her life, the postural stresses. And when we have postural stress, that leads to early degeneration and wear and tear and all sorts of arthritic problems like the lady on the left has. So we want to make sure that we do everything we can to avoid that as much as possible. Okay, you can go ahead and step down carefully. There you go.
Great.
In just a second, we'll have your foot scan up here on the computer. All right. The big thing that I look for is the left foot just like the right one.
Okay.
Okay. And over here we have what we consider an optimal pattern. There's 3 arches in each foot. There's one on the inside of the foot, one on the outside of the foot, and one across the front of the foot. It acts like a big spring. And when the spring is doing its job, the color pattern looks like that. And these are your feet. Does your color pattern look like that color pattern?
Not exactly.
They're a little different, aren't they? So we definitely have a bit of a breakdown in some of these structures of the arches. And your left foot definitely looks different than your right foot. And you're actually carrying more pressure on your right foot than the left foot. And that could be a significant contributor to postural stress. So that's something that we're going to take into consideration as we put together the pieces for your case, okay?
Right.